Hey, good evening. We begin tonight with the deadly outbreak on that cruise ship half a world away, now sparking fears right here in the U.S. The outbreak is responsible for 3 deaths already, and now there's a global race to contain it, extending all the way to America. At least 7 passengers who were on that ship and departed before the outbreak was fully understood are now back here in these 5 states: Virginia, Georgia, Texas, Arizona, and California. Health departments in all those states say those passengers are not showing any symptoms, but it's unclear how most of them are being monitored or if they're even being quarantined. And after that risky operation to evacuate the sick passengers, you see everyone there wearing hazmat suits. We now know that many of those showing symptoms are in fact positive for the virus. And look at this. This is where many of the passengers traveled to after leaving the ship early. And we now know one flight attendant on one of those flights is showing possible symptoms tonight. We have 2 reports, starting with Danielle Hamamdjian, where the ship is heading to in the Canary Islands off the coast of West Africa.
Tonight, as the ship at the center of the deadly hantavirus outbreak sails towards the Canary Islands, the World Health Organization confirming 5 of the 8 suspected cases have tested positive. The patients are being treated in hospitals in the Netherlands, Switzerland, and South Africa. Experts want to reassure the public, though, the risk of infection is low.
This is not coronavirus. This is not the start of a COVID pandemic.
On board the ship, Dr. Stephen Kornfeld, who spoke with NBC affiliate KTVZ in Oregon. He says when the ship's doctor became ill, he had to step in.
As things deteriorated and more people got sick and more people got seriously ill, I ended up just taking over and trying to keep everybody going.
Dr. Kornfeld says after 3 people who'd been on the ship died and others had to be evacuated, those who remain are now okay.
Fortunately, nobody else has got sick in the last 6 to 7 days. We now have 2 World Health Organization epidemiologists on the boat. We have 2 Dutch infectious disease people on the boat, so there's a lot of medical coverage now.
All part of a global race to stop the virus from spreading beyond that ship. Dutch authorities today announced that a flight attendant has been hospitalized with possible symptoms. She was on the same flight as one of the cruise passengers with hantavirus. That patient was removed before takeoff and later died, according to Dutch media. What's unknown, the extent of the interaction between that flight attendant and the passenger.
U.S.lar gönderiyor.
Those still on the ship finding relief to be moving forward. Dr. Kornfeld, among the 17 Americans on board, says he's been in touch with the State Department but is awaiting details on getting back to the U.S.
I assume in a couple of days there'll be a plan. So that plan is quite variable, and I really don't know what it will be.
So many questions. Danielle joins us now live from the Canary Islands. Danielle, we now know that cruise ship company says the boat is expected to arrive right where you are on Sunday. How will they get people off the ship?
Yeah, Tom, the ship will anchor nearby, and from there to the port to the airport, they'll be completely isolated from the rest of the public. But even with those precautions in place, there have been protests across the Canary Islands, as well as opposition by political leaders to this decision by the Spanish government. Tom.
So much uncertainty out there. All right, Danielle, we thank you. At least 7 passengers from that ship are now back here at home in the U.S., having left the vessel before the virus outbreak was known about. Are there plans for them to quarantine? Camila Bernal has that part of the story.
Tonight, confirmation from 5 states that passengers who were aboard the cruise ship with the deadly hantavirus outbreak are back in the U.S. 1 person in Virginia, 2 in Georgia, 2 in Texas, another in Arizona, and an undisclosed number of people in California. Health departments in all of these states telling NBC News that the former passengers whose identities are being withheld are not showing any symptoms. Texas explaining that the passengers have agreed to monitor themselves for symptoms with daily temperature checks. The other states declining to share how the passengers are being monitored. We asked each state if those passengers are quarantining. 4 would not answer that question. Arizona saying the person there is not isolating.
Should the passengers back in the U.S. be quarantining? Yes, at least for the duration of the 6 weeks since a known exposure.
Johns Hopkins microbiologist Sabra Klein says that's how long it could take for symptoms to show up if a passenger was exposed and contracted hantavirus. The confirmed Andes strain of the virus is usually transmitted through rodents, but in the rare cases of human-to-human transmission, Klein says there must be a high level of virus and very close contact.
In order for human-to-human transmission to occur, this requires intimate contact, like sharing a bed, like sharing utensils.
Unlike COVID, she says, hantavirus is not readily transmissible.
People in the United States do not need to be worried. This is not another pandemic. This will never have pandemic potential.
And with that, Camila joins us now. But Camila, the big question is the federal government doing anything to track possible exposure in the U.S.?
Yeah, Tom. So we now know the CDC has activated its Emergency Operations Center in Atlanta. It's a level 3 activation, which is the lowest. So it's not an all hands on deck situation, but it does help activate experts and coordinate point people for the response. And they'll be operating 24 hours a day. Tom?
So they're monitoring it. All right. Camila, thank you. We thank you for watching. And remember, stay updated on breaking news and top stories.